So this is your heel, and your whole body rests on your ankle joint.
Now that's 98% of your body on 2%.
Exactly.
Right. So if it's not perfectly aligned, what happens?
You're going to have a misalignment up your body. Yeah. So you get strain on your knee, hip, and back.
I love there's a phrase in some of the documentation I was reading about weight bearing.
Right.
And it's not just the weight, it's the movement too. So like when you run, every time you bang, it's even worse. So when this is put in, again, I tell people it looks like a screw, but it doesn't screw. The reason for these threads that's where the ligaments naturally attach themselves to.
Exactly, right. The ligaments are going to adhere to the threaded portion, and that prevents this from backing out.
And just so people can get an idea what we're talking about, let me see how tight we can get on this. This is, can we get real tight on this, guys? All right, here we go. This is what we're talking about. This is the stent, and it is in that area, right in there.
Right into the little space. Yep.
That's important, I think, for people to understand.
Right.
That it's a naturally occurring place it goes.
Right.
I just want to jump in here and say, now, Dr. Anthony Weinert, you're doing this. You're out promoting this around the world, okay? You're still doing it. You did one last week, okay?
Correct, yes.
As this moves forward and you see more and more patients with this, there's a critical mass that this has to reach at some point, because this is such a great and simple procedure. And it can be done. There are doctors around the country that are doing this now. How many doctors around the nation?
Oh, hundreds and hundreds, yeah.
So that's your website, which you can see on the screen. It's alignmyfeet.com. Right. This is where people can go and they can find a doctor near them.
Yeah.
And you're trying to get more doctors to understand this.
Right, yes.
What do you see in this with your patients when they come in and you tell them that it's a stent? What's their first reaction?
You believe it or not, a lot of patients already have done their research because now with the websites and with the technology and all that, as far as the my personal experience with it, the quality of life for these patients have changed dramatically, and I'm glad that we're getting it out to the public, because this is a very common condition that I feel is very undertreated, and I think we need to get it out to the public to tell them there are other things that could be done other than reconstructive surgery and all this, custom orthotics we talked about, that is just more of like a Band-Aid to the actual pathology.
Let's hear from a couple of patients that had this procedure done.
Yep.
I just was scared completely from having any surgery. I never had anything done. I mean, I was afraid that it would damage the ligaments. I couldn't move my foot no more. I mean, I didn't know what to expect from it. I didn't know it was that simple.
As far as I'm concerned, this procedure, the doctor, they're, an angel sent down to provide that relief, because I thought I was done with my feet.
I was ready to walk right away, and then shortly after I was walking and trying really hard to start to run.
Honestly, until about 5 years ago, when I found the HyProCure and I started performing it after having it being performed in my foot 5 years ago, that I was really able to see the benefits.
It's amazing stuff. Right. Hey, great, Anthony. Thank you for being here. Appreciate it. Yeah, that's Dr. Anthony Weinert. All right, we have more coming up. We're going to talk about what's going on today with children and how this can actually affect the future of our country, our health costs, and also the quality of life. That's all here on Inside Health with Dr. Michael Graham.